name is Sukhpreet Kaur. My student ID is 1649692114 and today I am going to perform the procedure of sterile wound dressing. So firstly, checking the doctor's order, performing hand hygiene. Hello, can I know your name and your date of birth? Can I check it on your ID? Thank you. So my name is Sukhpreet Kaur. I am a registered nurse here and the doctor has ordered me to change your dressing. Can I do that? Okay, so firstly I'm going to ask you some questions. Are you having any kind of trouble or pain? Can you rate your pain from 0 to 10, 0 being no pain at all and 10 being the worst pain? Okay, are you having any kind of allergies? Are you taking any kind of medications? Okay, so the patient reported that he has mild pain at the level of 3 and he is not taking any medications and he doesn't have any allergies. Now I'm going to manage my environment. I'm going to elevate the bed to my appropriate height. I'm going to reposition the patient. I'm maintaining the privacy. And now I'm going to perform the hand hygiene again. Now I'm going to put on my gloves. So I have put on my gloves. Now I'm going to prepare my tray which I'm going to use for my dressing. So I'm going to open the outer flap first, outside of my body. As you can see, the table is short, therefore that flap is hanging. I'm going to open it. I'm not touching the inside. I'm opening it, maintaining the sterile border. Now this tip is clean, but the tip is sterile. I have repositioned my tray. Now I'm going to manipulate my supplies. I'm going to place it here. Now I'm going to open the sterile causes, the abdominal pain pad. So now I'm going to pour the solution. From an appropriate height. So as you can see, I have maintained my sterile triangle. This is tray, this is my patient, and this is my garbage. So now I do not need to change my gloves as my gloves are clean, and I'm going to inspect my wound. I'm opening the dressing. So as you can see, there is mild serosanguinous discharge in there, which is from the wound. I'm going to inspect the wound. The location of the wound is at the abdomen, at the midline, just above the umbilicus. Now I'm going to measure the length of the wound. So as per my reading, the length of the wound is 13 centimeters. So the approximation of the wound, the edges are well defined and are attaching appropriately. The closing of the wound has been done with the sutures. There is no visible erythema or swelling. Now I am going to palpate the wound. Are you having any kind of pain? Okay. The patient reported mild pain, and while palpating I do not feel any tenderness or any edema. So this was all about the findings of the wound. Now I am going to change my gloves as I need to change the dressing. I am again performing the hand hygiene. I am changing my gloves. I have changed my gloves. Now I need to clean my wound first and then I will sterilize it with dress it appropriately. I'm picking it up from the top, as the top is clean and the inside is, the tips are sterile. I'm going to clean my wound first from the midline, top to bottom, one stroke, garbage. I'm going to clean it, squeeze it appropriately. I'm cleaning it the midline, which is away from my body, and then garbage it. I'm going to squeeze it appropriately. I'm cleaning now from the midline, one stroke, and the periphery, which is near to P. Now I'm going to pat dry my wound in the similar motion. Firstly, the midline, top to bottom, discard. Secondly, pat dry, periphery, discard. Third, pat dry and discard. Now I'm going to apply the sterile gauze, which is dry, over the wound. Now I'm going to apply the abdominal pad. The absorbent side is towards the inside. Now I'm going to place my forceps in the similar way. Now I'm going to secure my wound with the bandage. Now I'm going to document my findings, like my date and time of the procedure when I done the procedure. I have written the date and time. Now I'm going to change my gloves. I'm performing the hand hygiene. Now I'm going to reassess the patient. Are you comfortable? Okay. Are you having any kind of trouble? Okay. Now I'm devaluating the bed. Maintain the bed to the lowest position. I have repositioned the patient, and now I'm giving you a call bell, and if you need any help, you need to call me. Okay. So I have changed your dressing. Your wound is healing appropriately. So do you have any other questions? No. So can I go? Okay. So I have changed the dressing of the patient. I have cleaned the wound with betadine solution, and the patient tolerated the procedure very well. The findings that I am going to document in the EMR are: the length of the wound is 13 centimeters. The location of the wound is at the abdomen, at the midline, above the umbilicus. The edges are well defined, and the wound is approximated appropriately. The wound is has been closed with the and there is no any foul discharge which I found. The only discharge that I found is serous drainage. Other than that, there is no swelling, edema, or any tenderness which can indicate the infection. So it means the wound is well healing with primary intention. So this was all about my findings, and that I'm going to report to the doctor, and all about my procedure. Hope you like my procedure. Thank you.